This video is designed to help patients in Saskatchewan learn about the important things they need to know before and after a total joint replacement. The video lessons and steps outlined by the Saskatchewan Hip and Knee Pathway are designed to help patients through the process of the surgery and onto a healthy recovery. In this module, you will get an overview of post-surgery care, breathing, circulation, post-surgery exercises, and things to avoid.
So when you come back from surgery, likely you will have a dressing on your knee, similar to this.
The nurses, when you're on the ward, they will be checking the bandage daily. They will be changing it as required.
Well, nursing staff will monitor your dressing and your knee and your operative site. What we're going to watch for is any increased redness around the surgical site. We'll watch for swelling of that knee, which is common though after surgery. You may or may not have a catheter in your bladder. This would be removed when you're more mobile and able to get up to the washroom. Nursing staff will monitor your vital signs, and usually you'll see a blood pressure machine and a vital sign machine similar to that, and we will do that on regular intervals for your first few days post-operatively. You may have oxygen tubing on when you come back from surgery, and that is just to encourage you to get some good oxygen into your bloodstream. After an anesthetic, it's important that you get oxygen levels are adequate, and it's also very important that you do your deep breathing and coughing exercises, which will help to get the anesthetic out of your system, but also it reduces the chance of pneumonia, and you need to fully expand your lungs and do those breathing exercises. Your pain is also going to be monitored by nursing staff. We will ask you to describe to us what your pain level is on a scale of 0 to 10. And 0 will be no pain, and 10 is the worst possible pain ever. It's important that you take your pain medication quite regularly as well, because everything that you do as far as your therapy and your mobilization and your activity is dependent on making sure that you're as little pain as possible. You will rehab much better if we can control your pain. We will probably the very first night after surgery just give you a liquid diet when you come back from your surgery, just to make sure that your stomach is settled and that you're able to tolerate your diet. And then as you feel willing to take more, we'll get you up to a regular diet, probably by the next day. And rest and sleep is very important in your post-op period. It's important that you can limit your visitors to so that you can get your adequate rest. You can visit with them after when you're back home.
Some people will have staples and some people will have dissolvable stitches. People who have staples will be told to contact either their local doctor or the nurse to have the staples removed, usually at about anywhere from 10 to 14 days. But it's always important that if there is swelling in the leg, that you elevate it. So that involves lying on the bed, resting the leg on about 4 or 5 pillows so that the knee and ankle are higher than the heart. And you want to stay in that position for about 15 to 20 minutes. And do that as you need to throughout the day.
For most people after a knee surgery, the big thing is to try and get some range of movement happening around that knee joint.
So let's just review some of those exercises that it's so important that you do. So can you show me how you're going to do your foot pump exercises? Up and down with your feet, excellent. And how often do you think we're going to do those? What did we ask you to?
Hour.
That's very good.
Pumping your ankle up and down at least 10 times, and then tightening the muscles on the back of your knee, so kind of pushing your knee down into the bed and tightening the muscles in your bottom, so squeezing your bum together. And you want to make sure you're doing those every hour that you're awake, at least 10 at every spot in the lower extremity, and that helps just to prevent blood clots in the leg. For the lungs, we work on deep breathing, so you want to make sure that every hour you're taking at least 10 deep breaths. So you're taking a deep breath in through your nose and then trying to take little sniffs on top of that to really fill up your lungs. And then to actually cough a couple times after you do that, just to maintain the health of your lungs.
This is to ensure that you get lots of air into your lungs after your surgery, because you won't be quite as mobile as you were before. So what we're going to make sure you do is you get a good expansion of your chest here. So you're going to try to breathe from here. Take a deep breath in, sniff. Hold that for 3 to 5 seconds and relax. relax. There are certain things that you'll have to take precautions with after your knee surgery. One of those will be that you'll be unable to kneel until your knee is completely healed. So don't get down into this position in a kneeling position. Precautions that you're going to have to watch following your knee surgery, one of them would be to not get your knee into extreme positions. You wouldn't want to get down into a deep squat position. You certainly wouldn't want to get down into a squat position where you're going to lift something heavily, or another precaution, just stand up for me please, that you wouldn't want to be pushing anything with your surgical knee, with the knee that you've had surgery on. Another precaution following your surgery is you want to make sure you don't pivot or you don't twist on your surgical knee. In the book, its precaution indicates do not pivot, so you don't want to have your foot planted and then twist or pivot on the knee. If you're going to have to turn, take small steps as you turn and then come back with small steps.